Recently, the U.S. House of Representatives voted to bar Planned Parenthood health centers from all federal funding for birth control, cancer screenings, HIV testing, and other life-saving care. Supporters are falsely promoting these anti-women's health initiatives as a means to eliminate abortion care funding, but in reality, it's only eliminating funding for preventative reproductive health care that more than 3 million Americans rely on to stay healthy. That's why I'm joined right now by Brian Howard, President and CEO of Planned Parenthood Arizona. Hi, Brian.
Thanks for having me today. This is a subject I'd love to talk about.
What's the status on these two anti-women's health initiatives?
Well, where we are right now is that the U.S. House of Representatives has passed a temporary budget bill that they have sent over to the Senate for its consideration. There are two anti-women's health, there are actually many dangerous provisions in this budget bill, but there are two issues about which Planned Parenthood is particularly concerned. One is the entire elimination of the nation's family planning program, what's known as Title X. And here in Arizona, Planned Parenthood serves 13,000 women a year with that support. The other initiative within this budget bill about which we're concerned is known as the Pence Amendment. And it prohibits Planned Parenthood from participating in any federal program for any purpose whatsoever anywhere in the country. So no involvement in sexual health education, no provision of family planning, no testing and treatment for sexually transmitted infections, no early cancer detection.
Let's talk about Arizona for a moment. What does it mean to Arizonans if this legislation passes through the Senate the way it did the U.S. House of Representatives?
If this legislation comes out of Congress as it's drafted right now, it is going to be disastrous for Arizona women, both in general and specifically because of the impact on Planned Parenthood. The Title X program, the National Family Planning Program, serves almost 30,000 women a year across the state. It's designed entirely for the working poor, women who are at or below the federal poverty level, which is only $10,800 a year for a single woman. Obviously, these are people who benefit from being able to plan when and whether to have children, and this program would go away entirely, including Planned Parenthood's role in that of serving 13,000 women a year. I guess I would also talk about the fact that over half of all of Planned Parenthood's patients are at or below the poverty level. We serve 65,000 women a year in the state of Arizona. All of them will be impacted by the inability of Planned Parenthood to participate in the Medicaid program, which in Arizona is known as Access. And if the Title X program survives, we would not be able to participate in that either. It's really going to mean a loss of prevention services for the women and families who need them most. Yeah.
How will this legislation affect the funding of abortion care?
There's no relationship between what we're talking about in the federal budget and access to abortion. Federal law is very clear that it prohibits the use of federal funds to pay for abortion. The programs that we're talking about are focused exclusively on prevention-oriented annual exams, birth control, early cancer detection. And indeed, Planned Parenthood Arizona raises dollars specifically from private sources to help women access abortion care from private individuals, foundations, etc. So all of the money that we're talking about pays for prevention for Arizona's unemployed, underemployed, the working poor.
Arizona is consistently among states with the highest teen pregnancy and sexually transmitted infection rates. So how will the proposals influence those statistics?
Well, the loss of prevention services, or reduction in access to prevention-oriented services in Arizona is going to have a dire impact on teens. They're certainly among the women who are poorer, and may not have access to their own resources to pay for this prevention-oriented care. So it's going to very likely drive up teen pregnancy rates, but it's also going to drive up the abortion rate in the state. I mean, the abortion rate in Arizona has been in decline gradually for the past decade. If we lose this much family planning services, this much prevention, we're very likely going to lose, we're going to see the abortion rate go up.
Brian, talk to me about taking action for people who are concerned, Arizona citizens. What can they do?
Well, Arizonans, regardless of their feelings about abortion, should be contacting Planned Parenthood to express your support for prevention in the state. Should be communicating with Senator McCain and Senator Kyle, to whom this responsibility now falls because the budget is moved from the House to the Senate. The opportunity to do all of that communicating can be accomplished by going to our website, ppaz.org.
Well, he's Brian Howard, President and CEO of Planned Parenthood Arizona. And to help increase awareness, share this video with your friends and family. Plus, go to istandwithplannedparenthood.org to sign the open letter to House and Senate members. Take your stand now at istandwithplannedparenthood.org. That's istandwithplannedparenthood.org.